Some patients have difficulty getting their wounds to heal, but with the latest advances, St. John's Riverside Hospital offers a comprehensive program dedicated to helping adults with slow or non-healing wounds. This is Riverside Radio Healthcast, the podcast from St. John's Riverside Hospital. I'm Cheryl Martin, and with me is registered nurse Tara Armerino, the Assistant Director of the Wound Healing Center here at St. John's Riverside. Tara, which patients are excellent candidates for what the Wound Healing Center offers?
So at the Wound Care Center here, patients that would benefit from our specialized care, as you had said before, are any patients that have difficulty with healing any wounds between 2 and 6 weeks. And our Wound Healing Center also specializes in diabetic foot ulcers, pressure ulcers, venous ulcers, surgical wounds, burns, traumatic wounds, and any other chronic non-healing wounds.
Tell us about the specialized team that's available when someone decides to be a part of the Wound Healing Center.
Sure. At the Wound Healing Center, we have a wonderful multidisciplinary team. It consists of our physicians that include vascular, plastic, and podiatric surgeons. Along with our physicians at the Wound Care Center, we have certified registered nurses, which brings together our expertise and our skill sets.
What would a comprehensive treatment plan look like for a potential patient?
A comprehensive treatment plan at the center here. We utilize the latest in any of our clinical treatments, along with traditional clinical practices. However, at the Wound Care Center at St. John's, we pride ourselves in an individual treatment plan, and that may include wound dressings, bioengineered skin grafting, compression therapies, along with debridement, edema management, and non-invasive vascular assessment, along with negative pressure wound therapy.
Now, you also have a state-of-the-art treatment for patients who have not responded to other treatments, HBOT. So explain what it is, how it works, and the benefits.
Sure. At St. John's Hospital, we have a hyperbaric oxygen here, and we have 4 chambers that are up and running and we currently use. So hyperbaric allows a patient to breathe 100% oxygen, 2 to 3 times greater than the atmospheric pressure. And this is administered on a daily basis in one of our 4 beautiful chambers that we have. The result is more oxygen into the tissue, and hyperbaric encourages the formation of new blood vessels. As the new blood vessels develop, the red blood cells start to flow, delivering even more oxygen to the affected area. And this creates the optimal environment for the body's natural healing process to damaged tissue.
Which patients would be great candidates for HBOT?
So the patients that would be great candidates for hyperbaric oxygen would be patients that have diabetic foot wounds, soft tissue radionecrosis, patients who have had compromised or failed flaps or grafts, chronic refractory osteomyelitis, acute peripheral arterial insufficiency, crush injuries, and acute traumatic peripheral ischemia.
Now, Tara, you mentioned diabetes and patients with diabetes. Talk about your diabetic nutritional referral system.
Yes, at the Wound Healing Center, majority of our patients with non-healing wounds are diabetics. And what we have done is we have incorporated a diabetic nutritional referral for our patients. This is better to educate and to help our diabetic clients to have a better healthy eating plans. And this also helps to control their blood sugar, their weight, and help to prevent any type of heart disease.
Great. Now, you mentioned briefly about vascular patients as well. You also have a more detailed program for vascular and venous patients as well. You want to discuss in more detail about that and what it does?
Sure. At the Wound Healing Center, we have an on-site vascular diagnostic testing. which is non-invasive. This testing enables our physicians to diagnose and identify vascular and venous disease, which enables, again, the physician to make a treatment plan for the patient and possibly some type of surgical intervention if needed.
Tara, where is the Wound Healing Center located and when is it open?
So the Wound Healing Center is inside of St. John's Riverside Hospital in the Andrus Pavilion. We are located on the 5th floor, and we're on 5 West. Our hours of operation are from Monday through Friday, from 8 to 4 p.m. And at the Wound Healing Center, we have large exam rooms which can accommodate patients that may use wheelchairs or stretchers as a mode of transportation.
Tara, you've worked at St. John's Riverside for more than 30 years. What attracted you to devote your expertise for so many of the past few years to the Wound Healing Center?
I just really believe in this wholeheartedly. I believe in the center. I believe in the nurses. I believe in the treatments that we do. I have been a nurse on medical surgical units, and there I had patients that had wounds from trauma, non-healing diabetic wounds, and even surgical wounds. It was so gratifying to see patients that had these wounds, and we healed them so that they could get back to their lives and to their families. That's why I went to the Wound Care Center, because I believe that the community that we service here can all benefit from all of our expertise and our skills here.
That's great. Is there anything else you wanted to add just about the Wound Healing Center?
Yes, I believe wholeheartedly that the Wound Care Center at St. John's, the physicians and the nurses, we give the best care, the best treatments, and the best outcome to our community.
Tara, thanks so much for introducing us to the Wound Healing Center and its array of services. Tara Armerino is the Assistant Director of the Wound Healing Center. For more information about wound healing, please call 914-964-4630. That's 914-964-4630. Or email us at findadoc@riversidehealth.org. That's findadoc@riversidehealth.org. If you found this podcast helpful, please share it with others and check out other episodes of Riverside Radio Healthcast, the podcast from St. John's Riverside Hospital.